We have 5 major malnutritional problems in the country, which are protein energy malnutrition, vitamin A deficiency, and nutritional anemia, iodine deficiency, and that makes 5. And we have the ways we measure nutritional situation in the country. We have nutritional indicators like stunting, wasting, and underweight. Stunting is weight for age for height. When the child is 0 to 5 years of age and she is or he is very short for the age, that is called stunting. And stunting is very big nutritional problem in the country because according to the Tanzania Demographic and Health Survey study of 2010, stunting rates were 42%, which means 3 million children of Tanzania are stunted. And stunting is irreversible when you're 3 years of age. So the intervention to reduce or to alleviate stunting should be 0 the first day a mother conceives a child up to 1,000 days, which is 2 years of age of a child. So, as we said, 42 is very high because the World Bank or World Health Organization standards allows a country to have at least 20%, and we are 42. And prevalence of underweight, meaning weight for height, is in children of 0 to 15 months is 16%, is higher too. And prevalence of anemia to 6 to 59 to 69 months is 57 as per DHS 2010. Prevalence of anemia to women of childbearing age, meaning 15 years up to 49 years, is 40%. This is higher, very high, and it's alarming. And the problem with Tanzania is where the food is produced more is where the stunting rates are very high. So this explains that having food is not enough, but knowing what to eat and how to prepare the food you have. Makete, Sumbawanga, and Iringa are having very high stunting rates, and at the country level they are the higher producing areas. And stunting, as I said, has an effect because when you have stunting, your body immune system is depleted, is very low, so you tend to be sick. And if it's a child, we are told undernutrition contributes to 130 children death in Tanzania every day. Imagine, per day 130. What is about the whole year? Is big numbers. Undernourished children have weak immune system and suffer more frequently, and more severely they suffer infections, and the impact of their suffering is severe compared to those healthy kids. All kids they normally get sick, but those undernourished ones, they tend to be sick regularly. Up to half of children with severe acute malnutrition will die if they don't receive appropriate treatment. And adults who are born with low birth weight are at risk of giving birth to low birth weight children, and hence they are stunted. And as I said, in Tanzania we have vitamin deficiency, we have iodine deficiency, and we have protein energy malnutrition. But the vitamin deficiency which we know because of the studies which are done is vitamin A, and we have interventions for that. There's a clinical routine supplement which women are given after birth. They are supplemented with vitamin A, and children after 6 months when they attend clinic they receive vitamin A. We assume those children which are exclusively breastfed, they can get vitamin A from supplemented mother. But after 6 months, they are supposed to be supplemented routinely and in campaign twice a year. We do campaign in African Child Day, which is 16th of June, and AIDS Day, which is the 1st of December. So we do vitamin A campaign twice a year, and we iodate all the salt which is used in the country. And there's a law which is governing the production of salt, so to force all the small and big producers to iodate the salt. And we have campaigns of breastfeeding at hospital or health centers posts. When women are pregnant, they are taught on how to breastfeed and how to do proper complementary feeding as the age goes. This is all I can say about what we do, and there's this development that the government has entered. There's the SUN movement. SUN is scaling up nutrition, which is the president is among the few countries which has agreed to sign in the country to go and to scaling up nutrition. And we have launched the nutrition campaign in 16th of May in Nazimoja grounds, and the president was the pioneer of that event. And we expect to go to the regional level, to do a national day, to do a nutrition day to the regional level, and to the district up to community level. By so doing, we would advocate and we hope to reduce the amount of stunting by creating awareness, because we believe much of undernutrition in the country is caused by lack of knowledge and proper care of children. She can opt to breastfeed, and they are allowed and encouraged. We encourage for them to exclusively breastfeed for 6 months and then go ahead breastfeeding for a year. That is what we advocate. And still, if the situation of a mother, it doesn't give room to do that, because maybe she's not capable because of her health, she can use formulas, but depends on her choice. That is a choice. But we do, as a governing institution, we do advocate for even HIV positive women to breastfeed up to 6 months and then up to 1 year.
And do you think this campaign you have started, is it going to reach among a lot of people, say, in rural areas?
We do.
Or you have started here in urban areas?
We do think that it will trickle down to rural areas because, as you know now, we have regional nutrition officers and we have district nutrition officers. We at national level have started it, and we expect it to carry it to the regional level, and we will be joined with regional people who are working with nutrition, including the DMO, the RIMO, and the regional nutrition officer, and to go, they will carry from the regional level to the district level, where they will work together with those district nutrition officers. And from there, the district nutrition officers can carry to the community level. So if we want a stronger nation, we should start with strong kids, and how we should do it properly. We should breastfeed for 6 months exclusively. We should do complementary feeding properly, meaning we have balanced diet when we eat, and somebody, if is a pregnant, should avoid alcohol and smoking and eat proper food. And eating proper food doesn't need a lot of money. It doesn't mean having a lot of junk stuff. No, we have localized food which are very nutritious if they are cooked and prepared properly.